when you're going into a decision to have plastic surgery, it is not just a decision that's about a body change. You have to look at your whole body, your lifestyle, what your supplements are, your diet, and also your mind. You have to look at your whole body and how you can empower the patient to have a successful outcome.
Today, I am talking about breast implant illness and joined by plastic surgeon Dr. Julie Edween, based here in Beverly Hills, California. She is actually the doctor who performed surgery on me and implanted my breast implants and removed them after having them in for almost 10 years. She is a busy woman, but has made the time to be with me today. If you want a free Vitamix blender, then listen up. During the entire month of October, I am giving away a brand new Vitamix, which is the same one you see me use in my Instagram stories every single day. This $400 blender is used in top restaurants all over the world and in the world's largest coffee chain. If you want one, all you have to do is subscribe to my newsletter. That's it. I send out helpful tips for digestion, easy recipes, and fun food finds I discover. So pause this episode and go to littlesipper.com/subscribe and enter your email, and I'll be choosing the winner from there. And if you're not the lucky person, you're still getting free recipes, food facts, and grocery finds I discover. Plus, you don't want to miss my holiday gift guide coming up this holiday season. And information in my newsletter is exclusive and is not available on my actual website. And I never sell or give out your email to any third party. I am the only one who has access to it just to send out helpful information to better your life. So be sure you're in the running to get a free Vitamix. Pause this episode and go to LILSIPPER.com/subscribe and enter your email. I'll also leave that link in today's show notes so you can just go easily tap that and it'll take you right to it. And for double the chances to win a Vitamix, you can also submit a rating and review for this podcast in whatever podcast app you listen in. That's right. I'll also be choosing someone who rates and reviews this podcast to get a free Vitamix. After submitting your rating and review, just DM me a screenshot on Instagram. Over 16,000 research studies on sodium lauryl sulfate have shown links to irritation of the skin and eyes, organ toxicity, developmental reproductive toxicity, neurotoxicity, endocrine disruption, and biochemical or cellular changes. This is one of the most common ingredients in laundry detergent. That is just one of many toxic ingredients found in almost all laundry detergents and cleaning soaps. What we wash our clothes and sheets with is just as important as what we put on our bodies and in it. And it plays a major factor in our internal and external health. It can affect our digestive system, hormones, immune system, and thinking, as well as skin issues. That's why switching to a truly non-toxic laundry detergent is so important. If you haven't heard of Truly Free Home, then listen up. Truly Free Home's non-toxic and eco-friendly laundry detergent is free from all thickeners, dyes, optical brighteners, synthetic fragrances, and other harmful chemicals. It's available in plant-based essential oil scents or entirely unscented. And every first order arrives with a forever jug that is BPA-free, and all future orders are refills, making less waste. Plus, you get free shipping. Truly Free Home is offering my listeners 300 free laundry loads, and no subscription is required. Just click on the link in the show notes and get 300 free laundry loads, and it will be automatically applied. Well, welcome, Dr. Edween, for joining me today.
A pleasure. Thank you so much. I'm honored to be on your podcast.
Yeah. So for those listening, Dr. Julie Edween, she is based in Beverly Hills, California, and she is the doctor that she put in my breast implants, and also 10 years later was the one who removed them. And she definitely knows the my body anatomy. And so Dr. Edween, why don't you first introduce yourself and tell people who you are and what you do exactly?
Thank you, Bethany. My name is Dr. Julie Edween, and I have been in practice for 22 years. Seems like it just flew by.
Wow.
I am a facial plastic and cosmetic surgeon, and I specialize in natural results that don't look done. It's a nice balance. It's always a balancing act as far as what changes you can give the patient, but you just want them to look natural and good. I have been in a private practice in Beverly Hills for a while, 22 years, as I said. And I like to practice medicine where I put my patients first and their needs first. And I really take the time to listen.
Yeah, and that's something that I really appreciate about you, as you do take the time with every single patient, because as you said, you're altering someone's body. And surgery is definitely a serious thing. And first of all, let's talk about facial surgery. And what are the most common facial surgeries, or why do people visit you? Like what do you see, quote unquote, trending right now?
It's interesting you say trending because that is pretty much what drives the practice. There is always the tried and true, which when you talk about facial surgery, it's all about facial rejuvenation and a result that turns back time. However, the trends these days are trying to follow what social media presents. So when you look at the most common things I do on the face, which is facelifts, nose surgeries, eyes, you're always going to want improvement of that. However, what I've noticed these days is, since social media is such a driving factor in our world, is younger patients are coming in and asking for, say, like the improved jawlines, improved chins, or over designed lips, all which are been driven by social media. Mm. And I try to reel it back and look at facial balance and give someone a lasting result that, again, makes a difference but doesn't look overdone.
Right. And I kind of feel like to alter your face for something that's trending in 2 years, is it going to be trending again, and then that's your face.
Yes, you're absolutely correct. And that's the whole thing. It's trying to stay true to what is natural balance in the face. In fact, when we train, we always look at what is beauty, what needs to be balanced in order to enhance one's beauty. And if those balances change, again, that's the trends. And you say 2 years from now, now it might be in vogue to have like a much bigger chins, which the chins are evolving. Like before it was these overblown, almost fish-like lips, and now it's kind of pulling back. Thank goodness. It's a little bit more shape and volume as opposed to full lips. Mm-hmm. So we do it. I do think we change with the times, and it's a matter about being true to yourself and knowing what you as a doctor are comfortable putting out there, because there's always going to be, again, my practice is in Beverly Hills. It's kind of the epicenter where all this happens. Mm-hmm. My colleague down the street will put that in and have overblown fish lips, but I always have to maintain why am I in medicine and what are my patients going to look like when they're out there? And again, it's to improve that change, but keep them natural and balanced.
Right. Now, are there a lot of times where you actually steer clear or really tell a patient, hey, look, I really don't think this is a good option for you? Or do you kind of just go with whatever the patient says? Do you ever turn down a patient?
I do turn down a patient, and it goes with my philosophy on making sure that I put out results that I feel balances their face. I always take, again, the patient's idea into consideration, but I have turned down patients because if something doesn't look correct, I know that to being true to myself is not compromising those things. And there's plenty of colleagues of mine that will do that. But I do have an honest discussion as to what I can do to get to those goals, because that's why they're coming to me. But if it's over the top, it's something that I can refer out.
Mm-hmm. And you had mentioned you are seeing young patients in your office. And what is the youngest patient? I mean, are you able to disclose that you've ever worked on? And obviously they would have to have a parent's permission if they are under 18.
Well, traditionally, when you talk about younger patients, it has to do with something functionally that needs to be changed, that's impairing their lifestyle. So when I think of younger patients in my practice, I think of the ear pinning, like pinning back ears. Mm-hmm. And traditionally, when a child comes to age and starts getting teased, which is usually, around 5, 6, 7. Mm-hmm. That's when I'll consider doing something to their ears to pin them back, but it has to be, again, with parents' permission. The younger patients, as far as other younger patients I see, are the rhinoplasty patients. Because of mm-hmm. social media, it's driven even these really young boys and girls to come in. Their faces are developed after they're 14 years old. So I'll defer until their facias are developed to be able to do a procedure like a rhinoplasty. So mm-hmm. I tend to kind of wait on that. Mm-hmm. I like it. My preference is for them to be closer to 18 because they can make their own decision as far as what changes they want. So I'll encourage that, but sure. I tend to allow them to come into their own, if you will, before making those permanent changes in their life.
Right. And I do think that social media is huge in deciding factors. And then, people are getting teased. And let's talk about healthy versus unhealthy reasons to get plastic surgery. Because if you're getting teased and you have just, no self-confidence and like your entire life, you've had people just come up to you and, it's really kind of taking over your life. I would feel like that would be a healthier reason versus, what's trending? Now I want big lips, big cheeks.
And I do agree with you, Bethany. There's unhealthy reasons to have plastic surgery. And one is just, again, I'm going to follow the trend. It's like, I saw it on Instagram and they bring me in this Instagram photo and say, I want to look like this. That I can consider like a spur of the moment decision. Those people I counsel because the results of cosmetic surgery is lasting, and you need to be mindful of your decision and carefully think it through. So I will always go through an education process with that. Yeah. Plastic surgery should never be done to please somebody else, because it involves your body, and you don't want to go undergo a procedure when someone's pressuring you to do that, because that's a surefire way to not set yourself up for success, And
definitely. There's couples, I'm sure, and, I'm sure women do that to please their significant other, where maybe they were fine with the way they looked, but for whatever reason, their significant other wanted them changed. And that, I'm sure, happens more often than we realize. Let's talk about breast implants for a second, because I myself had them. I got them, I believe, right after I got divorced. And for reasons such as improvement, self-esteem boost, things like that. It was a very hard time. But I got them for a reason, and I was very happy with the results. And I had them for almost 10 years. And then I decided to get them removed. I wasn't sure if I was experiencing breast implant illness or if it was completely non-related. I do know breast implant illness exists. And I also know that there are people with breast implants who are not affected. And regardless, I decided to get them removed, and I actually came back to you to get them removed. And I felt very comfortable with you and confident in your work. And so it's been maybe 3 years now since I've had them, 3, maybe going on 4. I can't remember. But regardless, it was a decision that I had made. And I just want to thank you publicly for helping me along that journey. And have you ever experienced a breast implant illness in your practice?
Well, thank you for being so open and for coming back to me after all those years. And there is always been an awareness of this underlying thing we call breast implant illness. And it is something that is becoming a lot more prevalent. I have seen it in my practice, with you being one of them. And it started off as something where when patients would come with just a wide range of symptoms and they ask if it's related to the breast. And honestly, I didn't know because there's not a lot of research on that. But to your point, I have seen that with these wide range of symptoms that people are coming up with, whether it's joint fatigue or GI symptoms, that when the implants are removed, these symptoms disappear. And it doesn't happen in everyone, but there's a good majority of people that come to me that have had these. And it's not like I'm the first stop. They've gone to multiple doctors to try diagnose what it is that's happening. And this is kind of like one of those last places where they end up is, okay, I've gone to all these doctors. They're not quite sure what's happening, but this is where I'm targeting. And I have seen that with those patients, when I remove them and the symptoms resolve, I can't explain it, but it's life-changing, the difference in the patient's life. So yeah, I have seen it. And I think that more and more my colleagues, as much as we can't explain, and there isn't an official medical diagnosis, it's a very unique condition that we need to focus in on as a medical community to help change these people's lives and look at this as an entity that needs funding and a lot more research.
Yeah, I agree. And just speaking from my own experience, when I did get my breast implants removed, first of all, there was no mold. You did send me a photo of the implants, and they were clear, they were healthy, no punctures, anything like that. So that was one of the concerns. I thought, oh my gosh, are they moldy? But I did notice that my gut started to improve. It didn't happen instantly, like maybe some people claim. My arm range, I noticed I had more arm range, and different things happen. And I feel like it does take time. For others, I've heard they had eczema or psoriasis and their skin cleared up within 2 days after the surgery. And from the research that I've done is that the reason people experience breast implant illness is because it's a foreign object in your body, and it's almost like an autoimmune thing where your body is like attacking itself. And it's like, okay, what is this foreign object in my body? Let's get rid of it. And your body kind of just goes haywire, and all these other symptoms occur where it's like constantly fighting. And then again, I've heard that you typically don't experience the illness until maybe 7 or 8 years after you get breast implants in. So I know there's a lot of research that has to go into it. And I know you are just the surgeon, and you are just helping to improve people's lives. And I appreciate you just being open about that and being aware and advising your patients about everything that they may get into. Now, when preparing for plastic surgery, what advice would you give someone to say, hey, look, 2 to 3 months prior, do this, do that? Is there anything that you recommend as far as like improving their health and getting them ready for surgery?
Right. Yes. There's definitely things I tell my patients in getting ready for surgery. And I know we're specifically talking about breast implants, and I wanted to add something to the comment you just made,
please,
about breast implant illness, if I may go back to that.
Yes.
You spoke on a subject about the things that cause breast implant illness, and you were right on point, because they're also breast implant illness is also getting, there's another name they're associating with it, and it goes to what you were talking about, and they call it ASIA, ASIA, which stands for autoimmune/inflammatory syndrome induced by adjuvants. So exactly what you're talking about. They are looking at it as a disease process caused by certain things, which they think there's an autoimmune or inflammatory process underneath. So I wanted to kind of make that to your point. However, in your other question is about preparing someone for breast implantation.
Well, now that we're still on the breast topic here, I think a lot of people are interested, and I appreciate you bringing that up. So ASIA.
Yeah, ASIA, autoimmune inflammatory syndrome induced by adjuvants.
Okay, yeah. Just another point that I wanted to ask and also bring up is when I did come back to you to get them removed, I just remember this still to this day. And you told me, you said, Bethany, I'm seeing a trend, and not to, go back on the trends, but you said you're seeing a lot more people getting them removed, or a trend in smaller breasts in general. Like I don't know, maybe back in the early 2000s, like having big boobs was like a huge thing. It was trending. And now I remember you said a lot of people are going smaller again. Is that still the case?
Yes, it is still the case that people are trending. I'm using that word trending. It is the case that people are going smaller. We're looking at body proportions, and you're correct. In the 80s, it was all about, big breasts and something that doesn't balance the body. And oftentimes patients said, okay, I can fit in a dress, but I can't wear the shirt, or I can fit in a size, but I have to size up for my breasts. We're looking at smaller. What is that natural cup size that would allow you to pull a dress off the rack and just fit it, where you don't have to size up? Yes, people tended to go for big D's and C's, and now people are trending to the smaller C's and smaller B's. So that is definitely something that is still requested now. I'm seeing more of people getting a more balanced size that fits their body, which is really nice to see.
The days are getting shorter and cooler, which means the holidays are coming. That also means flu season. The combination of chilly weather, less sunlight, aka vitamin D, and the stress of all the hustle and bustle of the holidays packed into 3 short months really gets to me. So I especially load up on all the immune supporters in the last part of each year. One of which is Further Foods Ultimate Immune Support, which contains vitamin C, D, and E, zinc, and elderberry, plus 18 different herbs and mushrooms known to help support one's respiratory and immune function. I've been taking this for about 2 years, and I love that I don't have to incorporate other supplements because this is packed with the essentials. Further Foods Ultimate Immune Support is a doctor-formulated all-in-one immunity booster with 27 of nature's most potent immune-boosting ingredients. I also love that there's no silicone dioxide or unnecessary ingredients that you'll find in most other capsules on the market. It's free from common allergens such as soy, corn, dairy, and gluten. And if you want to try Further Foods Ultimate Immune Support, use code LILSIPPER to receive 15% off your order. Or you can receive 25% off your first order if you subscribe and save. So just go to furtherfood.com and use code LILSIPPER. That's furtherfood.com and use code LILSIPPER. I'll also provide a link in today's show notes that will take you directly there. Going back to that question, so if you were to get surgery, how would you prepare as a patient?
When I prepare patients for surgery, I first make sure that mentally they understand what they're getting themselves into, because it has to be a good, mindful decision. So a lot of in preparation and during my consultation, I'll ask and I'll make sure that you're mentally prepared to go through it. Two is getting ready. Once that decision's made, is how to set yourself up for success. So I look into their lifestyle. If they're getting body contouring surgery, I want to make sure that they have a healthy diet before and as well as after. So we'll look into what can I do to empower you to make this a lifestyle and lifelong change in your body. So those are the things I go over. I don't detailed go over their diet, but I do make recommendations for a healthy diet. And there are people that I can refer them out to if they're looking for more nutritional advice. But that's definitely something that I will focus in on. And of course, preparing your place for surgery. And people say, why? Why do I have to do that? It's because it helps, prepare your room for after, make sure your bed sheet linens are clean. So when you come from surgery, you don't have to worry about that. Preparing your fridge to make sure all the necessary healthy foods are there. It just makes life a lot easier on your transition, your post-op recovery, a lot easier if you don't have your caretaker or your loved one going out and keep running out and having to go to the local drugstore or the grocery store to help prepare you for that day.
Yeah, those are all great points. And especially the mental preparation, that's a really great point, is because you do want to be mentally prepared and ready. I'm sure and it's a big decision. And a lot of people, when you can't go back. Maybe you can eventually, but sometimes no, you can't. Especially if it's a facial surgery.
Absolutely.
And again, to your point, is if you are doing a body contouring surgery, maybe liposuction or a tummy tuck or something like that, it is definitely something you want to point out, is that this isn't going to necessarily solve the issue. If you're going to continue to eat the way you were eating to get the way you got, then it's going to come back eventually after the tummy tuck, So that is a really good point to bring up, is lifestyle changes too.
Right. And I wanted to add, when you're looking at facial surgery, especially in a facelift, and this is a routine thing I advise during my consultation, is it is documented that about 6 to 8 weeks after your procedure, because it takes a while to heal, some people go into a depression. And I think, and it's specifically with faces, because I believe since we're looking at in the mirror every day, we see our face and the changes take time. So I always prep someone ahead of time to say, if you're not feeling the greatest in about a month, because when you look in the mirror, the results aren't there, know that it's normal. Know that it's normal to feel a little bit down and depressed, because there's plenty of women that go through the exact same thing. So it gets worse before it gets better.
I can attest to that as well when I got the breast implants removed. And I also, actually, before I saw you for the initial breast implant, I actually also got was it after? I can't remember. Maybe it was like a couple years after I got my implants. I had a rhinoplasty surgery as well. And it took, I went to a different doctor for that. And it took me about a year to really heal my nose and to really see the difference. So a full year is definitely something, it's more realistic as a healing timeline.
For sure, especially with nose surgery. I always say, don't look at it for about a year, because it's going to go through ups and downs, and you're going to go through all kinds of emotions. But in the end, and a year is not a magical thing, but it's an average time where most people can see those final results that you discussed with your surgeon.
Yeah. And now, are there any, I know you said you don't really recommend a specific diet and you do outside source that and recommend people, but just off the top of your head, any foods to really help you heal from surgery?
Yes. And the foods there are definitely foods that help you heal after surgery. So on the top of the list is after surgery, you have to have protein and you have to have vegetable and fruits. It's that diet that probably every mom recommends to their kids. But lean protein like chicken and turkey and seafood, not a lot of fats in there. And if you're plant-based, you can always eat tempeh or tofu or legumes. Those are all good, but you have to have your protein because protein helps you heal. It's like that building blocks. It's the building blocks on what the collagen is for healing tissue.
Right. I bet bone broth is great too and all that good stuff.
A lot of people, thank goodness, and here in California are very healthy. And so they already understand that you have to have your protein and your vegetables. Your mom was right about vegetables. Yeah, I always recommend dark leafy green vegetables. It has a lot of vitamin C, a lot of iron, a lot of vitamin A. Those are all helping with the healing process. So I encourage that type of diet. And if someone says, I don't really know how to eat, I always go back to what is the closest thing to the earth? It's whole food that is not processed. So if you take anything out of this, and what can help you heal is just eat things that come from the earth and as unaltered as possible. Mm-hmm. The things that I say you shouldn't be doing is alcohol. I strongly recommend not drinking alcohol in the first few weeks after surgery and even about a couple weeks prior. That's a hard thing to do, but at least cut it down. And then you don't want to have high sodium foods. And definitely a no is smoking and vaping, anything like that, because that allows your tissues not to be oxygenated, and you need oxygen to heal.
Wonderful. Great tips. And I heard, what about vitamin K prior to surgery? If you take a vitamin K supplement, because that does thicken your blood, is that recommended or not recommended? It
depends on the surgeries that you're having, but surgeons tend to not want to have the blood altered for when you're looking at aesthetic surgery. So I tend to say don't do extra vitamin K right before the surgery. That way you can have your own clotting factors clot the way your body is designed.
Okay. And is there anything you tell people not to consume prior to surgery, like, blood thinners and things like that?
Right. So I have a list of things of foods and supplements to avoid, because one of the supplements are a huge part of what people intake into their body. And someone's always coming up with something new that I haven't heard of, but I need to know about those things. And traditionally, we don't want those in the body unless we're aware of them. And we can kind of go through each one and decide which one is going to affect. And the most important thing is it's called the bleeding time, or how much you bleed during surgery, because obviously you want to be able to control that. So those are things that's critical for us to look at before. And there is a big list, and your surgeon will give it to you prior.
What is your take on CBD for healing and pain? I know if someone, wants to go all natural, they don't want pain medication after the surgery. Is there anything natural that you can recommend?
My thoughts on CBD, I don't have a lot of experience with it. However, I have had patients that use it for calmness, use it for some pain. And so I am always open, because I look at the body as a whole, and I look at myself as a student of life, and there's always things to learn. So I will give them the option here is my advice and what I know that will help control your pain. But by all means, if there's something that can help, like CBD oil, let me take a look at it, because they're they're not all created equal. You need a very pure type of CBD oil to help you. And we can add that on as an adjunct to your healing process, but I'm open to it. With some of the procedures that aren't very painful and that can control it, no problem. But some of the ones that really do need some extra pharmaceutical help, I'll say, let's just keep it as an adjunct.
Sure. And then I remember using arnica after my surgery. And how do you feel about the arnica cream?
I like arnica. It is a homeopathic supplement that has been highly studied in our, even in our plastic surgery medical literature. So it helps with postoperative bruising. And so if that can help, by all means, I encourage that. There's also a thing called bromelain, which is an extract from pineapples, which has a strong effect on swelling. So that's one of the other homeopathic medications that I'm on board with that helps with the healing process.
Interesting you brought up bromelain because that's actually a great digestive enzyme, but you said it also helps with swelling.
Yes. And yes, bromelain is, it is a digestive enzyme for sure. It's one of them. And so it helps with swelling. And I believe that, the gut, and this is a different topic, is definitely the source of a lot of disease processes and inflammation. So bromelain being part of a digestive enzyme, I think ties in with all of that inflammation and swelling and things like that.
Yeah, well, that's great to know. Now, is there anything else you want to add before we close here?
I believe that when you're going into a decision to have plastic surgery, it is not just a decision to that's about a body change. It has a lot to do with your lifestyle surrounding it. And I appreciate this opportunity to talk about this, Bethany, because it's not just here's what you need to do before and after. As far as medically, you have to look at your whole body, your lifestyle, what your supplements are, your diet, and also your mind. And that goes into something that is my philosophy and what I believe. You have to look at your whole body and how you can empower the patient to have a successful outcome. And that kind of goes, I follow you in Instagram because I believe that you do that too. So I appreciate all the efforts that you're going through to educate the public on ways to eat healthy and heal yourself.
Yeah, well, thank you so much, Dr. Edween. And again, you just brought up another just thing I wanted to add to that when people do get plastic surgery, it is often to boost their self-esteem. And going back to being prepared mentally, I often see this a lot is people get the plastic surgery and they're happy with the results. However, their self-esteem has really not changed, and then they find something else and it's almost like they're not satisfied. And so just going into that, and I'm sure maybe you've experienced that, is that, with patients, is that they have to mentally be like, okay with just getting one thing done. And you know what I mean? And just kind of stopping, because in life, just there's always going to be things we're not going to be happy with or satisfied. But I think there's a really mental shift that we have to make, and happiness really doesn't come from the outer, but it really comes from the inner. And so, I think you are doing great work in helping people feel more confident, though. I do appreciate that.
Well, thank you very much. I know we can't fix what's going on the inside. And if your mind is mentally prepared, it does give you a boost. However, it does take a harsh look at the inside to understand why you're going through this. And there are certain people that won't be satisfied. But if you get mentally prepared, it sets you up for success as far as, you look good, you feel good.
Yeah, I love that. Thank you so much, Dr. Edween. And where can people find you?
I have an Instagram at Dr. Julie Edween. That's dr.JuliEedween. I also have my website, which is www.dredween.com. And then my office number in Beverly Hills is 310-859-8885. I'd be happy to see you guys.
Wonderful. Thank you so much for that information. And thank you for all that you're doing. And I was going to say I'll see you soon, but I don't know if I'm having any surgery soon, but maybe we'll get lunch or something.
That sounds great. I look forward to that. Thank you for the opportunity to talk to you later.
Thank you. Thanks for listening to this episode of Digest This. If you enjoyed this episode, please leave a review in your podcast app to let us know. If you're ever wondering how you can support me and this podcast, sharing it with your friends and family is the best way. This is a Resonant Media production produced by Drake Peterson and edited by Chris McCone. To email the show, message us at digestthispod@gmail.com. See you next time. The content of this show is for educational and informational purposes only. It is not a substitute for individual medical and mental health advice and does not constitute a provider-patient relationship. As always, talk to your doctor or health team first.